All right, do it. Does it look like we have a quorum?
Yeah, I think we have it.
Okay. Ready?
Yeah.
Like to call the House Health Full Committee meeting to order. If you guys would be so kind as to log in, and will the clerk please take the roll?
There we go.
Ready? Yeah. Clerk, take the roll.
Mr. Chairman, you have 19 members present. You have a quorum.
All right, thank you. And we have a full agenda today. And before we get started, does anybody have any personal orders? Chairman Martin, you're recognized.
Thank you, Mr. Chairman. Today, I have several good friends here. The chiropractors are here for Day on the Hill, so welcome them. And also Carroll County Chamber leadership is here. So I've got all my good buddies. So thank you all for being here.
All right, thank you. Okay. Any further personal orders? Okay, we have is Dr. James McKenzie, a psychiatrist from Nashville, is our doctor of the day. Thank you. Welcome. Appreciate you for being here with us. And then I would be remiss. My wife is a pharmacist. And so today is Tennessee Pharmacists Association Day on the Hill. So I'd be remiss if I did not mention that as well. So thank you guys for showing up, and I hope you have a great day here. So thank you. So we have 15 items on today's agenda, and a few of these we're going to take care of right now. Item number 1, House Bill 106 has been rolled 1 week without objection. Item number 7, House Bill 693 has been rolled week without objection. And item number 15, House Bill 395 has been rolled 1 week without objection. That brings us to item number 2. And that will be House Bill 111. Representative Martin, you are recognized. You have a motion and a second. You may proceed.
Thank you, Chairman and committee. Last year, a constituent brought to me a concern that she had discovered in her graduate studies at the University of Tennessee at Chattanooga as she was researching an increase in reported cases of congenital syphilis. Between 2019 and 2023, there has been a 548% increase in reported cases in Tennessee alone. Cases left untreated can lead to adverse birth outcomes, miscarriages, and congenital anomalies, affecting a child's development. For babies who were born with congenital syphilis in 2022 and 2023, at least 53% could have been prevented with adequate and timely syphilis screening. And I want to thank the Department of Health that's here with me today for helping to push this conversation and prioritize the health of our babies in Tennessee. This bill updates the frequency of Tennessee testing requirements like those in Texas, North Carolina, and Arizona, and it adds an additional syphilis screening between the 28th and 32nd week of gestation, as well as at the time of delivery. And lastly, the department added that hepatitis B testing at the physician's discretion and mandatory hepatitis C testing. And the department and I stand ready to answer any questions that you have, and I would appreciate a favorable outcome today.
All right, thank you. Any questions for the sponsor of the bill? All right, seeing none, we are ready to vote. Clerk, will you open the vote? All those in favor vote yes. All those opposed vote no. Has everybody voted? Anybody wish to change their vote? Clerk, please take the vote.
Mr. Chairman, you have 22 ayes and 1 no.
All right, thank you. House Bill 111 passes and goes on to calendar and rules.
Thank you, committee and chairman, for the favorable outcome.
Thank you. That brings us to item number 3. That will be House Bill 104. Leader Cochran, you are recognized. You have a motion and a second.
Thank you, Chairman and Committee. House Bill 104 initially was being carried by our good friend Kevin Raper. Of course, we know he's in recovery right now from his liver transplant, and definitely praying for that, and seems to be doing very well. This one is a cleanup bill, and so there are numerous places in code where the Department of Disability and Aging, there's still a few places where it's referred to as the Department of Intellectual and Development Disabilities, really just cleaning that up. It's also updating some of the department's record-keeping practices to align with current state standards. I'll yield to any questions.
All right. Do we have any questions for the sponsor of the bill? All right. Seeing none, we are ready to vote. Clerk, will you open the vote? All those in favor of House Bill 104, moving on to calendar and rules, vote yes. All those opposed, vote no. Has everybody voted? Does anybody wish to change their vote? Clerk, take the vote.
Mr. Chairman, you have 21 ayes and 0 nays.
All right. Thank you. Your House Bill 104 moves on to calendar and rules.
Thank you, Chairman and Committee.
All right. Thank you. That brings us to item number 4, House Joint Resolution 120. Chairman Powers, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman and committee. HJR 120 urges the Department of Health to implement a voluntary reporting system for CMT. And that's not country music television, as my buddy mentioned. It's Charcot-Marie-Tooth disease. You may remember country music legend Alan Jackson revealing in 2021 that he had been diagnosed with CMT. He was diagnosed in approximately 2011, and this affects about 25,000 Tennesseans. And honestly, we don't know how many it does affect, because that number was derived by multiplying a national percentage times our population. Accurate information will help our competitive for federal research grants and specialized care. And that's what this resolution will help solve. We want to identify the exact number of those who have CMT by implementing a voluntary system through existing health records, and produce an annual report back to the health committees and health Senate committee. And with that, Mr. Chairman, I'll be glad to take any questions.
All right. Thank you. Do we have any questions for the sponsor of the resolution? All right. Seeing none, we are ready to vote. Clerk, can you please open the vote? All those in favor of House Joint Resolution 120, moving on to calendar and rules, vote aye. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? Clerk, please take the vote.
Mr. Chairman, 23 ayes, 0 noes.
Thank you. House Joint Resolution passes and moves on to calendar and rules.
Thank you, Mr. Chairman and committee.
That brings us to item number 5, House Bill 62 by Chairman Sapicki. You have a motion and a second. And I believe, before we get started, you have an amendment.
We do, Mr. Chairman. It's drafting code 003987.
You have a motion and a second on Amendment 003987. If there's no objection, let's go ahead and put that on. All those in favor say aye. Aye. Opposed? Ayes have it. We are back on the bills amended. You are recognized.
Thank you, Mr. Chairman. And we do have a gentleman that wishes to speak on this also. He is the head athletic trainer for the football team at the University of Memphis. So I'll be very brief in my remarks, okay? First of all, thank you, committee and chairman. This authorizes an athletic trainer who has obtained the proper training and certification to use dry needling and other physical modalities for the prevention, recognition, evaluation, management, disposition, rehabilitation, and treatment of athletic injuries. It clarifies that the practice of dry needling by an athletic trainer does not constitute the practice of acupuncture. It authorizes the Board of Athletic Trainers to promulgate rules to allow the practice of dry needling. It requires the board to establish minimum competency requirements that an athletic trainer must demonstrate in order to practice dry needling, including at least 24 hours of dry needling specific instruction and 50 hours of additional instruction. requires the board to approve the schools and organizations that provide such instruction. And for the purpose of this promulgating rules, the legislation takes effect upon becoming law. For all other purposes, it takes effect September 1st, so the board can get the rules promulgated, Mr. Chairman. On dry needling, members, if you need a better explanation, the person here from Memphis can probably give you a better explanation.
All right, thank you. Do we have any questions before we go out of session? All right, seeing none, without objection, we will go out of session. And I believe we have Bryce Sawyer.
Sawyer.
Sorry. Okay. If you can, for the record, give us your name, who you're with, and you have 3 minutes.
All right, yeah, my name's Bryce Sawyer. I serve as the head athletic trainer at the University of Memphis. I'm speaking beyond of the athletic trainers of the state of Tennessee to express my strong support of House Bill 22. This bill would grant athletic trainers the ability to utilize dry needling as a treatment modality to better care for their student athletes. Just to give you guys a background on athletic trainers, sometimes people think athletic trainers and personal trainers are the same, but athletic trainers are highly qualified, multi-skilled healthcare professionals who play a central role in the health and safety of our student athletes. According to the National Athletic Trainers Association, an athletic trainer is defined as a healthcare provider under the direction and collaboration with a physician based on the education, training, and regulations set by their state statutes. The scope of services include injury and illness prevention, wellness, promotion and education, emergency care, examination and diagnosis, and therapeutic intervention and rehabilitation of injuries and medical conditions. Just to give a little background about the education of athletic trainers, prior to just a few years ago, athletic trainers were an undergraduate degree, but now in order to practice athletic training, one must graduate from an accredited program, currently a master's level position, and then pass the board of certification to obtain a state licensure, depending on what state. I've just given you a little bit of background on dry needling. Dry needling is a technique used by healthcare providers to address pain movement issues, particularly those associated with myofascial trigger points, as defined by the Cleveland Clinic. Dry needling also involves inserting thin needles into near trigger points and muscles. The needles stimulate the muscles, causing them to contract or twitch, which helps alleviate pain and increase range of motion. Dry needling is used one or more monofilament ligament needles, which are inserted into specific areas based on muscle or trigger point being treated. This process helps decrease muscle tightness, provides blood flow to the area, and in turn muscle function, and reduces pain and accelerates recovery. The term dry means that no substance is ejected, only the needle itself. A lot of people want to know kind of what the difference between dry needling and acupuncture. Dry needling and acupuncture may appear similar, but they're distant in both technique and purpose. Acupuncture is rooted into Chinese medicine, focuses on energy flow within the body, and in contrast, dry needling is more of a Western medicine that targets specific muscle areas to treat localized pain and dysfunction. I believe House Bill 62 would empower athletic trainers to integrate dry needling into their practice and further enhance the ability to provide effectiveness, comprehensive care for our student athletes. I appreciate your time and consideration, not only at the University of Memphis high schools. This would be the Memphis Grizzlies. This is the Nashville Predators. Every athletic trainer in the state of Tennessee would benefit immensely.
All right, thank you for your comments. We have a list starting here of some folks that like to ask you a few questions here. Representative McKenzie, you are recognized.
Thank you, Mr. Chair, and thank you for coming today. I know you tried to come to subcommittee last week, but Snow had a little something to say about it. So thank you for making the trip over. So did I hear you say that every athletic trainer, high school, wherever, has a master's degree?
Starting a few years ago, yes, the educational shift has changed in our program. So like when I was graduated in 2008, I have an undergrad degree. I did go get some extra training with a grad assistantship, but moving forward, starting in 2020 or 2021, I don't know the exact year, but now every athletic trainer is an entry-level master. It's just kind of like physical therapists. It used to be a master's, now they're a doctorate. So they're kind of, the education's kind of moved up that way.
You recognize?
Thank you. So, you know, as I've learned a lot about dry needling in the last month or so, I guess my concern, and hopefully you'll help put those to rest, is, you know, dry needling in the thigh or forearm or, elbow will be one thing, but you get to some of the more sensitive areas in and around the neck, the spine, things where you can potentially do more damage. Is there any level, or are there levels to where a trainer or a person that's gotten this training that they can stop? And let me ask you that. Then my second question is, you said things are done in consultation with medical professional, a medical doctor. Is there a point where if you're in and around the neck or some of the other sensitive areas that you must consult a doctor prior to dry needling?
Yeah, consultation is always important. I don't think it's a must, but when we take these dry needling courses, whether you're a physical therapist, athletic trainer, or anything, there's levels to the courses. So obviously you start off with the basics. And so you can take multiple levels of dry needling courses, but they're also, the education is very important, knowing the anatomy, whatever healthcare professional you are. And so if I do a thigh, I may use a different size needle versus when I'm using a neck. And so obviously the anatomy and the landmarks are important. So basically that goes back to the education. But if you don't feel comfortable with doing something, that would be malpractice if you just went in there without the knowledge of doing it as well. So just because you have your level of training, you also got to be conscientious of the anatomy of the body.
Thank you.
All right, Chair Lady Carringer, you recognize?
Thank you very much. Actually, I had a question and I have a statement. My question is, does Alabama have this in their state right now?
I think they are in the process of working that. I do not think they do have it.
Okay. And I'm not going to mention the representative's name in front of me, but I have a very, very good friend whose daughter is in Alabama, has gotten her master's and everything, and is working for a university that I will not mention in Alabama. And so therefore I was very much for this bill. I'm going to be voting for it because I want to get my good friend's daughter back in Knoxville, Tennessee, or at least in the state of Tennessee here soon. So thank you very much.
Yes, ma'am.
Any further questions while we are out of session? Mayor Hicks, you recognize?
Thank you, Mr. Chairman. You mentioned having like a master's degree. So at what level I'm trying to think of the right word. At what level can a athletic trainer say if a athlete was struggling with being dehydrated or something like that? Are you all qualified to, do IVs to help those athletes or do you have the training for that and the education for that currently?
Yeah, it kind of obviously depends on the state. I have personally taken a course in IV training. And so obviously I will say as these master's level classes have came, and obviously, as you know, we've kind of opened up the Practice Act for some other things with athletic training. They are teaching that now, in classes, IV training and some of those other modalities there as well. And so obviously you can take courses that are under the Board of Certification. So that's our national board that keeps up with our contingent education. And so, yes, it kind of depends state by state. But I will say more and more programs now, the entry-level masters are teaching dry needling as well as IV training.
Thank you, Mr. Chairman.
Okay. Any further questions while we are out of session? All right, seeing none, we'll go. Thank you for your time with us. Appreciate what you do.
Thank you.
We will go back into session. Okay, questions? Chairman Williams, you're recognized.
Thank you, Mr. Chairman. Thank you, Representative Sapicki, for this bill. I did have there was some discussion about the training associated with different levels. I've, like you, spent a little bit of time in a training room in college, and there was it was a completely different time for trainers back then. It was an undergraduate level degree. Would your bill allow for those who graduated prior to the master's level to get certified and be able to do dry needling if they had an undergraduate degree, or is it limited only to those who did get the master's level degree?
You recognize?
I think the bill kind of speaks to the ability of the board through the promulgation of rules. I think if the board of athletic trainers deems that, hey, to make sure that we are all synced up together with the master's level and those who have been maybe possibly grandfathered in from their time, that the board could promulgate rules to make sure that those people seeking to be able to do dry needling would correspond with the coursework that's in the bill.
You recognize?
Thank you. So it's your intent as the bill sponsor to allow for someone with an undergraduate degree or a master's level degree since, in the last 4 years, that both of those would be able, it's your intent that both of those would be able to practice dry needling if this bill passes in its current form?
You recognize?
As long as they would go through the training as prescribed in the bill, yes.
Thank you. I have a little bit of knowledge about this kind of training. My question is, can you describe to me like the duration of time? Is this something where somebody takes off out of the training room on Wednesday and comes back with certification on Sunday, or 24 hours could be 3 days of practice, I suppose, with some guidance? Is that how this training would work?
You recognize?
I don't believe so. It would. I think what you would see is it'd be a reflection of what the physical therapist in their rulemaking already has in progress in their rules. What we're doing is kind of something even above and beyond that for athletic trainers. Is we're actually codifying what they have to do, where physical therapists are just in rule, which could be changed rather easily. Where now we're codifying it for athletic trainers to make them rise to a higher level, because we are, as the General Assembly, we are saying, no, this is what you must do to be able to practice those modalities moving forward. I think what it would do is it would put a higher burden on our athletic trainers to limit the amount of flexibility that our physical therapists have in rulemaking, to where this board is saying, no, you have to do this to be able to qualify.
Right. And I appreciate your description of it. My concern would be someone who, to use your example, the scope of practice was changed for physical therapists to be able to do dry needling. There was also, similar to your bill, a certification requirement training associated with doing such. In this bill, but however, in all those instances, those people had a master's or a doctorate level degree associated with physical therapy prior to going to get the training. My concern would be much like an undergraduate degree, there would be a vast difference between the two, and maybe that training wouldn't be long enough. If I heard correctly, it says 24 hours of training, an additional 50 hours of additional training outside of that. My assumption is that's with someone in consultation who is trained already to do this, where they're practicing this type of procedure. Is that correct?
You recognize?
If you could ask the question again, I lost you about halfway through that. I'm sorry.
Yeah, so it's a gift. So the 24 hours is the baseline of education component of it. Then there's the work, for lack of a better term, the work product of an additional 50 hours based on what I heard you say earlier. If that's the case, that 50 hours, does it have to be in a clinical setting with someone who's certified already to do acupuncture, where they're overseeing their training?
You recognize?
And that's where the nuances of the bill come in. Just like the physical therapist, the board has that ability to put that into their rules when they move forward, of exactly what level they want for these individuals to be able to do the athletic or the dry needling.
Okay, thank you.
Thank you. Any further questions? Okay, I did have something for you, and it goes to an earlier question as well. And, I've had this discussion, and it goes to the management of adverse effects. And I think it's in section 4 of your bill. And I just, obviously the training, where they might be doing this may occur either at the training facility, or they may be at an event across the state or something like that. But as somebody who has performed this and has had this done on me, the two of the risks obviously are dealing with a hematoma potentially, or a pneumothorax. So if you're doing dry needling around the chest, and even that's a small needle, that could happen. And so is it your intent for their training within management of adverse effects for them to cover those type of adverse effects?
Yes, Mr. Chairman, it is to make sure the board has that flexibility to do that.
Thank you. Representative Mitchell, you recognize.
Thank you, Mr. Chairman. Sponsor, in your bill, though, setting the requirements of your bill, it's a whole lot higher than most other states are requiring, isn't it?
You recognize.
I believe so.
You recognize.
Yeah, the hours, I mean, it's like more than double what other states are requiring. I think so.
You recognize.
Yes, sir. I think the reason for that is the physical therapists saw the importance of that extra time in the classroom and training. And so we want to make sure our athletic trainers go through that same rigor.
All right. Thank you. Any further questions for the sponsor of the bill? All right. Shirley Lane, you're recognized.
Hold on.
There we go.
Thank you, Mr. Chairman, very much.
Still getting used to this.
Do we expect this to increase the insurance costs of the therapists at all?
You recognize.
I would say no.
It hasn't done that in other states? Well, then that must show that the risk is kind of low if it won't affect the insurance costs. So I'm just guessing, but thank you.
You recognize.
And I think that speaks to what we already have in place for physical therapists and and I believe chiropractors also. The level of training that they have to go through leads a level of confidence that these individuals, once they take this training, are able to do this type of treatment for people.
All right. Thank you. Okay, any further questions for the sponsor of the bill? All right. Seeing none, we are ready to vote. Clerk, please open the vote. All those in favor of House Bill 62 as amended going on to calendar rules, vote aye. All those opposed, vote no. Has everybody voted? Does anybody wish to change their vote? All right, clerk, please take the vote.
Mr. Chairman, 21 ayes, 1 no, and 1 present not voting.
All right, thank you. House Bill 62 moves on to calendar rules as amended.
Thank you, Chairman of the Committee.
Thank you. That brings us to item number 6, House Bill 157. Chairman Eldridge, you are recognized.
Thank you, Mr. Chairman and members. This bill is just very simple. It seeks to change the Tennessee code, the reference in Tennessee code from adult daycare to adult day services. It's just a more respectful way of addressing people that need special care. And I would hope that you all would look favorably on it. That's all it does.
All right. Do we have any questions for the sponsor of the bill? All right. Seeing none, we are ready to vote. Clerk, will you please open the vote? All those in favor of House Bill 157, vote aye. Opposed, vote no. Has every member voted? Does any member wish to change their vote? Clerk, can you please take the vote?
Mr. Chairman, 22 ayes, 0 noes.
Thank you. House Bill 157 moves on to calendar and rules.
Thank you, Chairman and Committee.
Thank you. Okay. That item number 7, we have rolled 1 week, so that takes us to item number 8. Let me get caught up here. That would be House Bill 760. Chairman Darby, you are recognized.
Thank you, Mr. Chairman. And I've got an amendment with this.
Okay, we have an amendment. I have drafting code 003911. Is that correct?
Yes, sir.
Okay, you have a motion and a second on the amendment. If there is no objection, let's go ahead and get the amendment on there. All those in favor say aye. Aye. Opposed? Ayes have it. We're back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. The amendment makes the bill. There was some technical corrections were requested by the Department of Health and Pharmacists Association. And those three was the bill would take effect July the 1st, 2026 to give everyone time to promulgate the rules. Number two was we narrowed the definition of healthcare practitioner to include only those licensed in Title 63. And number three gave the Board of Pharmacy authority to promulgate the rules in addition to the State Board of Education. And the intent stays the same. This bill simply allows for schools to keep an emergency stock of inhalers for quick relief, life-saving medication for children who are experiencing an asthma attack.
All right, thank you. Do we have any questions for the sponsor of the bill? All right, seeing none, I do want to commend you for, did you? Okay, let me, Chair Lady Carringer, you're recognized.
Yes, yes, when I saw this bill, thank you for bringing it for someone who has asthma, someone who has a son that has asthma, and having to keep an inhaler at school. But then there were also complications from that in terms of being able, for him to have it and give it. And also, it's very much needed and very much life-saving. So thank you.
Thank you, Chairman.
All right. Thank you. And so I do want to commend you for bringing this bill. I've made comments in subcommittee as somebody who has asthma. Obviously, times have changed, and back in the day, I could carry my little inhaler around with me. I still have an inhaler up in my office, so my assistant knows she's had to run for my inhaler before. But this is much needed. I can tell you that, even to this day, if I know that a couple weeks ago, I went skiing and I had to have my inhaler with me when I was skiing. So this is something that is much needed, and appreciate you bringing it.
Thank you.
Thank you. All right, we are ready to vote. Clerk, will you please open up the vote? All right, all those in favor of House Bill 760 moving on to education, vote aye. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? Clerk, can you please take the vote?
Mr. Chairman, 22 ayes, 0 noes.
All right, House Bill 760 passes and moves on to education.
Thank you, Mr. Chairman and committee.
All right, thank you. All right, that brings us to item number 9, House Bill 496. Mr. Reedy, you are recognized.
Thank you, Mr. Chairman. House Bill 496, a quick summary of the bill. It increases from 26 to 46 the disability onset age as it pertains to the Achieving a Better Life experience known as ABLE. With that, the proposed legislation keeps Tennessee compliant with federal law and preserves the ABLE program's tax qualified status by raising the age of disability. With that, Mr. Chairman and committee, I can go much deeper if necessary.
All right, thank you for that explanation. And do any members have questions for the sponsor? Seeing none, we are ready to vote. We will be voting on House Bill 496. Clerk, will you please open the vote? All those in favor of 496 moving on to Finance, Ways and Means, vote aye. All those opposed, vote no. Has every member voted? Any member wish to change their vote? Clerk, will you please take the vote?
Mr. Chairman, 22 ayes, 0 noes.
All right, thank you. Your bill, House Bill 496, moves on to Finance, Ways and Means.
Thank you, Chairman and committee.
That brings us to item number 10. House Bill 386. Representative Butler, you have a motion and a second. You are recognized.
Thank you, Mr. Chairman and committee. This legislation would increase the age from 14 days old to 45 days old, that a facility may receive the possession of an unharmed newborn infant without the mother being subjected to criminal liability. Currently, 4 states have a window of 45 days: Alabama, Indiana, Kansas, and Missouri, as compared to only 3 states that have a window of 14 days: Tennessee, Washington, D.C., and Wyoming. Some states, Louisiana, Oregon, South Carolina, South Dakota, Texas, Iowa, New Mexico, and North Dakota even go past the 45-day mark, with North Dakota being up to a year old. This is important because it provides more flexibility for the mother to determine whether she feels she is capable of being a parent. This extension will allow mothers who may be under incredible stress or experiencing fear more time to use a confidential and non-judgmental path to make a life-saving choice for their newborn. With that, Mr. Chairman, I renew my motion.
Thank you. And we have Representative McKenzie. You're recognized.
Thank you, Mr. Chair. And as I stated in subcommittee, I thank you for bringing the bill, and I thank you for, in this case, tripling the amount of time that a mother has can be held harmless on a life-saving, potentially, generational life-saving decision. My concern is, and it's really concerned with 14 or 45 or 60 days, is that potentially this could be held as a potential weapon in terms of if it's 50 days. So she's not. She wasn't, she made a good decision, but that good decision was at day 50. And, it could potentially be used as a weapon. So I'm not saying that that's happening, but as I think about it, there's no real way to tell, I don't think, from a baby from 45 to 40 to 55 days, what that baby, maturity looks like. So someone's going to go digging in, look at birth records and things like that. So if you have an overzealous DA or something like that, it's concerns me. But like I say, it's a concern today, and it really isn't addressing your bill, other than saying, I wish we could have gone longer for that period of time to where we can make a definitive decision. And I just think that process postpartum is extremely volatile and difficult. And so that's my concern with a date specific, especially such a short period of time, 45 days. So thank you.
You're recognized.
Thank you, Mr. Chairman. And let me address that. The current law allows for a medical professional, when that child is taken to an emergency room, which is what's required, whether that's abandoned face-to-face or whether that's put in a baby box. And so that medical physician, that medical professional is then going to age that child based on characteristics of the child and development of the child, et cetera. So that's always addressed. And the way the law is written currently, it says the child appears to be 14 days old. I couldn't tell you the difference myself, and especially if the child was premature, but a medical professional, I'm confident, could do that. Now, Mr. Chairman, I'm always willing to accept an amendment to move it to 90 days if the committee felt that was necessary. Thank you.
Thank you. Representative McKenzie, any further questions?
Amen to that. Thank you.
All right. Any further questions for the sponsor of the bill? All right. Seeing none, we are ready to vote. Clerk, will you please open the vote? All those in favor of House Bill 386, moving on to Finance, Ways and Means, vote aye. Those opposed, vote no. Does every member voted? Does any member wish to change their vote? Clerk, can you please take the vote?
Mr. Chairman, 22 ayes, 0 noes.
All right, the ayes have it. House Bill 386 moves on to Finance, Ways and Means.
Thank you, Committee and Chairman.
Thank you. That brings us to item number 11. And that will be House Bill 657 by Leader Hicks. You're recognized. You have a motion and a second.
Thank you, Mr. Chairman. I have an amendment, I think, that makes the bill.
Okay, is the amendment drafting code 003754?
That's it, Mr. Chairman.
Okay, I need a motion. You have a motion and a second. Okay, if there's no objection, let's go ahead and get the amendment on the bill. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
Thank you, Mr. Chairman. This Recovery Act will create a level right-to-work field for healthcare providers who have been disciplined and have completed a peer assistance treatment program. House Bill 657 allows any healthcare provider who has completed a peer assistant treatment program to request a regulatory license board to remove any information made public. This bill allows the information to be removed, if approved, only by the board, and if it has been more than 5 years after the completion date of that program or contract. Thank you, Mr. Chairman. I'll be happy to answer any questions.
All right, thank you. Do we have any questions for the sponsor of the bill? Representative McKenzie, you're recognized.
Thank you, Mr. Chair, and just thank you, Representative Hicks for bringing this bill. I think as we look at our dearth of healthcare providers, absent everyone in the room here, this is just it's an outstanding way of saying we understand that it's a difficult road you all trod to get to a terminal degree with medical degree and these advanced degrees, and that sometimes things happen along the way from a mental health standpoint, and mistakes are made, and that you should pay for your mistake. But after a period of time, you should be able to practice the field that you've dedicated your life to achieving, and that not be it's considered a death sentence. So this is a very humane bill, as we talked about earlier. I wish we could get that date down a little bit. So my question, you said 5 years. Is that a change? Is that?
You recognize.
Thank you, Mr. Chairman. It is a change. We decided that 10 years was probably too long, so 5 years is more adequate, and happy to do that.
You recognize.
Again, thank you, and thank you for that change as well. So this makes a lot of sense, and I really applaud you and whoever else put this thing together. So thank you, Mr. Chair.
All right, thank you. Any further questions for the sponsor of the bill? All right, Chairman Kumar.
Thank you, Mr. Chairman. Thank you, Representative Hicks. For me to understand it clearly, what we're saying is that if a professional, and in this case, does it apply to a physician? It does. If they've had a substance abuse problem and they have gone through rehab and restored themselves, while during that process, have they still been practicing medicine?
You recognize.
Thank you, Mr. Chairman. No, I don't think at that time they are practicing medicine.
You recognize.
So they've taken a hiatus of time while they were under treatment and not practicing medicine. Is that true?
Yes.
Okay. So after 5 years of that hiatus, they can now come back having stayed clean or having rehabilitated themselves, which is admirable. They are now able to come back to practice with no previous record of any problems.
You recognize.
You are correct, but it's up to the board that makes that decision. It's not up to the healthcare provider. It's not up to the doctor. Okay. It's totally up to the board and how they see that they have finished and completed their peer assistance program. That's the key to this is if, in addiction, if someone is not up to par and not doing well in that world, you know it. And if they are doing well, then you know it. There's no question. So I would hope and pray that the board would be qualified to know that the physician would be back on track.
Chairman Williams had a comment he wanted to make real quick, because I think he might clarify.
Yeah. Thank you, Chairman. Thank you, Chairman Hicks. I think we kind of got a little bit confused here. I think what this bill does, and maybe legal should clarify it, but I think what this bill does is allows a practitioner who has violated the substance abuse policy or whatever as it relates to their licensure. This allows for them for that violation to be hidden from the public after 5 years. And so it would be on their license and they would be practicing medicine. They would be required to be clean as a part of their licensure. But as it relates to the violation of their policy, they couldn't have that removed, so that if someone wanted to go and check on that physician or medical practitioner within that 5-year period, this violation would be there. But then after 5 years, the board could have it removed from the forward-facing view of the public. it would still be a part of their normal record, but not so that the public could see it. If the chairman wishes for legal to confirm that, I think it would be important for the record to make sure that we understand that.
Yeah, that's my understanding. I'm going to go out of session, have legal. Without objection, we're going out of session. You're recognized.
Heather Oswell, Legal Services. What this bill does is that it says the provider has an adverse action taken against the provider's license, and then part of that action resulted in the provider being issued to complete some sort of peer assistance or substance abuse disorder treatment. They have to complete that, and then 5 years following the completion date of that program or contract, then the adverse action will be removed from the public-facing licensure verification website. However, in G2B, it does clarify that the order remains public record as put in 10.7503. So it's still public record, but it's taken off of the public-facing licensure verification website.
While we're out of session, do we have questions for legal? Are you good with that? Okay, good. All right, we will go back into session. Okay, any further questions for the sponsor of the bill? Chairman Kumar.
Just to follow up, I think a couple of things. One, it seems that when a person has a substance abuse violation, policy violation, did you say that they would continue to practice medicine? I guess depends on their rehabilitative status, and that would be determined by the Board of Medical Examiners.
You recognize.
Can we go back out of session?
Can you answer that? Yeah. Can you repeat the question?
My question was that for a practicing physician to be found in violation of their ethics as well as the substance abuse policy, whether they continue to practice medicine subsequent to that, or they're allowed to practice medicine under some degree of supervision and monitoring, that decision would be with the Board of Medical Examiners.
Okay. Without objection, let's go out of session. Legal Services is recognized.
Heather Oswell, Legal Services. This bill does not speak to that specifically. It's just speaking about following the completion of the treatment program. It doesn't speak to whether or not a provider can practice during that time.
And while we're out of session, question? Chairman Kumar, you recognize.
No, thank you. Are we back in session?
No, we're out of session. Do you want?
No, I
question?
don't have any
Okay.
question for legal.
Okay, we will go back into session. Chairman Kumar, you recognize.
Thank you. Okay, so this bill does not address that. Then let's come back to a physician who, after 5 years of having stayed within the norms of practice, and the public view of their past history will be not available to public anymore. I do have a concern because relapses do happen, and 5 years is not enough time at all. I'm concerned about that. And what is the reason? Why do we want to hide it from public?
You're recognized.
Repeat that question. Why do we want to hide it from public?
Can you clarify your question?
Please clarify.
What we are saying is that it would no longer be the information that this person has had previous substance abuse problems, this practicing physician, that would no longer be available to public view. That's what your bill does, right? And I'm saying is, why should it not be available to public view? Because really, when public and people search a physician, there's a great degree of trust involved, and they need a lot of reassurance. And 5 years may be enough time in your judgment. It may not be enough time in somebody else's judgment. But I don't know, why do we want to allow that not to be a part of an open policy where people know about it. These physicians usually practice under some degree of supervision, and one of the supervising bodies is the Tennessee Medical Foundation, who monitor these people on a regular basis with testing, surprise testing, as well as, and make sure that they are staying clean during the time that they are practicing. And having practiced and having seen colleagues of mine who were under such supervision, it was an open book thing. The hospital knew it, hospital staff knew it, and it was a good thing because we could then monitor them, we could watch them. If we found something was going on with their life that was irregular, then we'd say, okay, is this a tip-off that they may have slipped in their abstinence of substance abuse and so on. And I think by having it as an open book policy, these people served better, they were monitored better, and the public was served better.
Thank you. I'm going to, while we're at this point, I actually have Department of Health is signed up to testify, and I think they can help clarify some of the concerns or the questions that you have. So without objection, I'm going to call up Department of Health.
Thank you.
Okay. We are out of session.
Thank you, Chairman. Holt Witt, Department of Health. I think I can provide some clarity. So if someone is directed by the board to enter into a remedial program with TMF or another entity, they would complete that program. And then at the end of the program, 5 years after they completed the program, they would have that information removed from the public-facing portion of the website. We, when working with the stakeholders, we determined it'd be difficult for us to redact the minutes or video recordings of meetings, which are things that are publicly available on our websites currently. We also may have some licensure compact issues that would require us to retain that information so that individuals could become licensed in other states or that information could be verified. But we would be able to remove it from the publicly searchable database that is on the front of our website. So you would be disciplined by the board, you'd enter into your remedial program, and then 5 years after the completion of your remedial coursework or program, then you would be eligible to have that information removed.
Chairlady Carringer, you're recognized.
And, okay, so I'm really trying to wrap around this because I serve on Metropolitan Drug Commission Board in Knoxville, Tennessee, have for many years, and mistakes happen, and addiction is very real. And I don't think any of our families have not had some form of addiction with our loved ones and friends and all. So I am certainly, this is no offense to my colleague down here or what you all are trying to do, but I do have a real concern with the fact a physician and keeping it from the public eye. I think if you're the patient and you're going to go to this doctor, or you're thinking about going to this doctor, or you've been recommended to go to this doctor, I feel like as a patient, as population and all, that you should be able to find everything about this doctor that there is to know. I don't think this is something to hide behind. And my husband's a hospitalist, as most of y'all know, and my daughter was, and now she's in private practice for a little different schedule. However, with medicine, all of y'all, let me tell you, medicine's 24/7, no getting away from it. So it's very serious, and it's even more so because there's so much more. I mean, people are living longer, and there are drugs available to treat a lot of things. Unfortunately, we still don't have a cure for a lot of cancers, and I could go on and on. But the one thing about a physician is they have a DEA number. And this is taken, this is very serious in my opinion. That DEA number, yes, we have cracked down a lot across federally, state and all, but there still are ways, and particularly anyone who is around medications to get that are a little more easier accessible. So, this isn't, I don't know if this was really helped our health department and our health that brought this bill that feels the need to do this. But I wasn't even contacted that this was really a bill happening and a need. I think 5 years, and I mean, they say as you get older, the years pass by faster, and they certainly have. I mean, 5 years has gone by like that. I mean, so I'm just concerned about what is the need to hide this from the public. I mean, I think people I have known that have gone through, they're not ashamed of it. They're happy that they have gotten on the other side of this issue. So I guess I'm confused at why we're trying to hide this from individuals who may be wanting to go to that physician. And that's what I'm concerned about that. And they've got DEA numbers. They can do whatever kind of addiction they may have. And so I'm just concerned about what are we trying to hide? Really, why are we trying to hide this?
You're recognized.
Thank you, Chairman. So the department worked with the stakeholders to provide language so that our boards could better interpret the statute. We are deferred on the legislation. It did not originate at the department, but we feel very comfortable as amended with the legislation. It does give the authority for the board to make that final decision, and they're the same entity that's recommending the probationary period and its terms as well. And so we feel as though they're well equipped to make that decision after the 5-year time limit is up if the individual wishes to have their information removed. But we're deferred on the bill. It did not originate at the Department of Health.
So to that point, so somebody has, had an abuse problem or something along those lines, and they have entered into a program. They have completed the program to the board's qualifications or whatever restrictions have been put on their license during the time they go into treatment. And then they complete that. And then at the end of the 5 years, they can petition to have it removed, and the board does not have to remove it.
Correct. Yeah. The timer starts after the completion of the remedial program, whatever the board has instructed them to do. Then 5 years later, they can petition the board again to have that information removed from the website.
So from this, clean for that 5-year period, or whatever the rules come in and whatever other steps have to be done, they are clean at that point in time and then can petition. And then, like I said, the boards don't have to remove it, but this would be an option for them to remove.
Correct. Yes, sir.
Right, thank you. Chairlady Carringer.
Yes, I just have one more question. I mean, I'm thinking about nurses, I'm thinking about attorneys, I'm talking about educators, I'm talking about any other profession out there. And I don't know. I'm asking. I'm just asking. I'm just making this. Are there any other professions out there that go through boards and all that have this opportunity to do this within 5 years? I'm just asking. I mean, what's fair for one is fair for all, in my opinion, in this situation.
You recognize?
Chairman Carringer, I'd be happy to get you more information. I work with the Department of Health and our board, so I don't have a working knowledge of the rest of them, but I'd be happy to look into it.
Thank you. Chairman Kumar.
Thank you. I respect the intent of the legislation, that is that somebody who has had an real addiction lapse and they are dependent on this, they've gone through a time and they're clean, and we don't want to hurt their chances to practice and have patients come to them. I see that. But there is a sense of fairness and a responsibility to the patient who's going to choose that doctor. And has the Tennessee Medical Foundation been part of this construction of this bill that we are talking about?
You recognize?
Thanks, Chairman. I have not worked directly with the TMF on this specific language, but I don't know.
Would you agree that they are basically the experts upon dealing with physicians who have had an addiction problem?
I do know that they work frequently with the Board of Medical Examiners when they do identify someone that needs to enter a treatment program.
Okay. Well, thank you. As I said, I realize the intention, but there is a responsibility towards the patients also. I will hold the further discussion after we are back in session, Mr. Chairman.
Chairman Hicks.
Mr. Chairman, we have the Pharmacists Association here that can speak on this, and I think they're signed up.
Okay, I got them. All right, thank you. We will bring the Pharmacy Association. Okay, just give us your name and who you're with for the record.
Sure, thank you, Chairman Terry. Anthony Pudlow, CEO at the Tennessee Pharmacists Association, and we were part of a multi-stakeholder group that looked at this issue. From the pharmacist perspective, we have heard from our members that have gone through their own recovery program to kind of speak into this issue. And to clarify, I think some of the comments from the department too, we know, at least in our experience, what I've seen and observed, not every contract is a 5-year contract. If, say, a pharmacist in this case might relapse, if you will, during that 5 year, it might get extended, correct? And so that's why we, I think, could work with the department to say 5 years following the completion of the program. But yes, from what we have experienced, there are pharmacists that are even just trying to get part-time work after going through a successful recovery plan. And they're still struggling. Employers are seeing this and they're fearful of the concern. And so what we're trying to do is just allow that opportunity for them to petition the board and allow that to potentially be taken off that license verification piece. But yes, that's what we're hearing. And I believe that's the same situation for some of the other allied health professions that were consulted.
All right. Questions? All right. All right, seeing none, thank you for your testimony. Without objection, we will go back into session. Chairman Hicks, you're recognized.
Thank you, Mr. Chairman. I want to make just a couple of points. There was a law passed in 2017, and healthcare providers who entered and completed a peer-assisted treatment program after 2017 have no information posted in the system. Healthcare providers who entered and completed a same peer-assisted treatment program before 2017 do have their information posted. So there was something passed in 2017. So anyone after that does not have that information posted, but we're trying to take care of the ones before. And you know, speaking from someone, this goes. I understand it deals with patients, but it also deals with folks that have struggled with addiction, and you never overcome addiction. I mean, I've struggled with addiction my entire life, okay? You never really overcome it, but you do get better and life does move on. And I would hate to think in my field, I'm not a doctor, but I am a home builder. And I do have a license, and I would hate to think, you know, that there would be a list that my name associated with the things that I used to do would still be posted on that. I would hate the thought of that. And I think that's what this is trying to address. It's about the livelihood of the doctor and moving forward with their life. And getting rid of the stigma of that. And I think it's important in people's lives to move on like that. And I think that's the purpose of this bill, is to just get everybody back on a level playing field. And I feel confident. I feel confident in the board. I feel confident that, you know, if someone hasn't finished the program, that the board will keep the information up. But if they've done well and finished the program and doing well, and you can tell it, then that information should be taken down. Not necessarily, don't only look at the patients, look at you know, healthcare is an ever-changing world, and there's a shortage. There's a huge shortage of healthcare workers. So there's a lot of movement in that there wasn't too many years ago. So I think it's very important to look at that, and that's what this is trying to address. Thank you, Mr. Chairman.
Right, thank you. Chairman Hicks, you're recognized.
Thank you, Mr. Chairman. And this is to the sponsor. And just make sure I'm clear. So prior to 2017, those providers that are going through this particular process. So after 10 years, do they get removed off that list after 10 years? Do the board they actually have that authority to be able to do that?
After 10 years, they have no information posted
Okay.
currently.
So even those, I'm sorry.
You recognize?
So even those before 2017, so you're talking 2 more years anyways, and potentially they could be cleared anyways, right? Am I seeing that right?
Current, yes.
Okay. All right. Thank you, Mr.
All
Chairman.
right, thank you. Chairman Kumar.
Thank you, Mr. Chairman. Once again, I'm sympathetic to the plight of the professional who's suffering through this. And as Chairman Hicks said himself, you never overcome addiction, so relapses do happen and they're possible. I personally have known a number of physicians that I practiced with who were under monitoring because of their history of addiction, and they were able to practice without any difficulty. And one of them is still in practice at this time and is very loved, respected by fellow patients. And the problem is well known, yet it is very important that it be open and so that the person can be monitored in a good, loving way, which communities do. And I don't think it is an impediment to their practice that this piece of legislation is posted, this piece of information is posted on the website. And as those people before 2017, they are now at this time practicing and have practiced with that information there. Sincerely, so are we talking about the main gist of this bill, the main point, is it that we are cutting that 10-year period down to 5-year period, Mr. Sponsor?
You recognize?
No, Mr. Chairman. No, that is not the purpose of the bill. We're cutting it down to 5 years, but we're trying to take care of the folks that wasn't taken care of in the 2017 bill is what we're trying to do, and get everybody back on a playing field.
Recognize.
Sincerely, thank you for your patience. Thank you for your patience, Mr. Chairman, and thank you for explaining it to us. I feel very sincerely concerned about it. I think we have to have a balance, and I don't really think, having been in the field for 40 plus years, having practiced along with physicians who did have these problems, I don't think it's a difficulty as far as them being able to make a living, being able to practice and serve the community. And I don't think it plays any role at all in physician shortage at all. I would request most sincerely, if you would roll this bill by a week or 2, let us talk more about it, because I think it's really crucial and important. I would so move.
Is there a second? All right. Vote. Okay. Okay. Is there objection? Object. Okay, objection. Okay. We're going to voice vote on the motion. All those in favor of rolling 2 weeks, vote aye.
Aye.
Opposed? No. All right.
All right.
All right. Motion fails.
That was
Chairman
not
Williams,
a
you're
good
recognized.
move on my part.
Thank you, Chairman. Thank you, Chairman Hicks, for bringing this bill. I was going to call the question, but I think it's really important for us to note, in statute, this body has multiple times given people the opportunity to clear their records as it relates to criminal offenses, because it's really hard to get a job. And the fact of the matter is, these people, in that instance, we're not requiring that they even be clean. In this instance, what we're saying is if you violated that policy and you came before the board and your license was noted that you did this and you got clean, and 5 years later, you're still clean, that the forward-facing portion of that website, it will be stricken from that so that you can go back to work, so that scarlet letter, much like somebody's been adjudicated in the courtroom to get things expunged. We're doing exactly the same thing, just on the forward-facing side, so that we can put the workforce back to work in our communities so that patients aren't concerned, because the board, themselves are not even concerned about it. So I really appreciate this bill. I think it's going to make a huge improvement, particularly across our state, as we have these people in our audience today because there's a workforce shortage in healthcare. We need more healthcare workers. These people have proven themselves to be clean, and I think we should give them the right to have that scarlet letter removed. And I look forward to supporting this bill.
All right, thank you. Representative Capley, you're recognized.
Question on the bill.
All right, question has been called on the bill. All right, we are ready to vote. Clerk, will you please open the vote? All those in favor of House Bill 657, moving on to government ops, vote aye. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? Clerk, please take the vote.
Mr. Chairman, 15 ayes, 4 noes, 1 present not voting.
All right, thank you. House Bill 657 moves on to government operations. All right, thank you. That moves us on to item number 12. Yeah. I need a motion first. House Joint Resolution 69 by Chairman Martin. You're recognized.
Thank you, Chairman and committee. 2 weeks ago, I asked our health subcommittee to announce their favorite exercise. And the point of that was to reach out and let individuals understand that health starts with self. So we started that conversation in health subcommittee. This here is a blueprint of what we're going to try to do across the state to put health back in the hands of the individual and make sure we're making correct steps forward as a state. So this here is just a resolution to lay a groundwork of how we're going to try to move forward as a state as we go. A couple of options are reforming food economy, looking at SNAP, how we're doing that currently, supporting lifestyle medicine and health education. So what that will do is look at early childhood education, increasing exercise, increasing recess, things like that in our schools, educating individuals on unlocking health savings accounts to use for things like nutrition and exercise and preventative medicine options. Number 3 is encouraging good governance, looking at regulatory reform, protecting Tennesseans from certain substances that are in the food industry, and then leading by example in state institutions. And that's us leading from the government standpoint as well as in our schools and putting health as mainly the main topic back into where we're heading. And with that, I stand for question.
All right, thank you. I think Chairman Clemens, you're recognized.
Thank you, Mr. Chairman. What is lifestyle medicine?
You're recognized.
Lifestyle medicine could be a number of different things. So in this generation, in this portion, we're talking about anything that would lead to a healthier lifestyle component. So you could have alternative medicine options. You could have healthy living, yoga practices, anything that would fall under that category.
And does this bill support an increased access to fresh fruits and vegetables?
It does. So on the one part of it, we talk about supporting local farmers. So one of the things that we know, especially in rural Tennessee, is we have food deserts. We have issues of not getting substance to those individuals. So one of the things I'd like for us to continue to look at, and that's what this resolution is kind of pushing towards, is to find ways to support the local farmers in those smaller communities, get those fresh produce and things into our schools at an easier access.
You're recognized.
Thank you, Mr. Chairman. And fresh fruits and vegetables are often expensive, and that's why they're somewhat limited availability to families. So it's certainly an issue I hope we do work towards. Does this bill support increased access to healthy school meals?
You're recognized.
Thank you. Not directly addressed in this bill, but I'd be in favor of that component, absolutely.
So okay. Does this bill support an increased physical education or additional recess time at school?
It does, yes, sir.
All right. Well, I would like to think that it would to support increased access to healthy school meals. I mean, you know, we've got children in an environment for a big part of the year, and I think it's important that we make sure that they have full bellies and are ready to learn. So, if those school meals are healthy, that'd be fantastic. So, thank you.
Thank you. Any further questions?
Thank you, Representative. I agree with that as well.
All right. Any further questions for the sponsor of the resolution? All right, seeing none, we are ready to vote. Clerk, will you please open the vote? All those in favor of House Joint Resolution 69, moving on to calendar rules, vote aye. Those opposed, vote no. Has any member voted? Does any member wish to change their vote? Clerk, please take the vote.
Mr. Chairman, 21 ayes, 0 noes.
All right, thank you. House Joint Resolution 69 moves on to calendar and rules. Okay, thank you. That brings us to item number 13, House Bill 572 by Representative Hemmer. You are recognized. You have a motion and a second.
Thank you, Mr. Chair. This summer, I was looking to do some research and try to find a bill to help our maternal health and maternal mortality crisis we have in Tennessee. And I read our maternal mortality review committee task force report the Department of Health does. If you haven't had a chance to read that, I urge all members to do. One thing it said, it really stood out to me. It said it encourages policymakers and healthcare systems to prioritize increasing awareness and education of pregnancy and postpartum conditions. So I met with the Department of Health, met with the March of Dimes, stakeholders. And one thing I heard really stood out to me. He said, learning the warning signs of healthcare complications saves lives. So I was able to come up with this legislation. House Bill 572 requires the Department of Health to publish essential education materials about maternal health on their websites. These resources, which are mostly already available, would then be provided to hospitals and birthing centers to all new mothers and their families before discharge, as many life-threatening complications develop after mothers have left the hospital. So examples of these include mostly the cardiovascular infections, but postpartum preeclampsia, blood clots, postpartum hemorrhage, embolisms, and also very important, we don't talk about enough, of the postpartum depression symptoms. So this bill helps address that critical issue we see in Tennessee, where we had 55 mothers die from pregnancy complications in 2022, and 76% of those were preventable. So this, by ensuring mothers and caregivers receive this crucial information, the bill aims to help families recognize the dangerous symptoms before they become life-threatening. So this legislation draws from a similar measure that was done in Louisiana last year and was developed in support with the March of Dimes. And I appreciate the work and different advice given by THA, Department of Health, and others is coming up with this.
Thank you, and appreciate the explanation. Do we have any questions for the sponsor of the bill? All right. Seeing none, we are ready to vote. All those in favor of House Bill 572, clerk, open the vote. All those in favor of House Bill 572 going on to calendar and rules, vote aye. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? Clerk, please take the vote.
Mr. Chairman, 16 ayes.
All right. House Bill 572 passes and moves on to calendar and rules. All right, thank you. Next brings us up to item number 14, House Bill 192. I'm going to pass the gavel to Chairman Leatherwood.
Thank you, Mr. Chairman. This does bring us to item 14, House Bill 192. Have a motion and a second. Mr. Chairman, you're recognized on the bill.
All right. Thank you, Chairman Committee. House Bill 192 is entitled the Individualized Investigational Treatment Act and is essentially a continuation of the Right to Try Act we did in 2015, where the Right to Try Act created a parallel process for terminally ill patients to participate in generalized treatments. This trial will update the process and include targeted individualized treatments, such as gene therapies designed for each unique patient. In 2018, the federal level enacted a Federal Right to Try Act, which has been successfully operating in conjunction with the FDA. However, since that time, science has evolved to include these individually targeted treatments. While the law has needed to be updated, other states have updated their statutes to accomplish this for their patients and to allow them the freedom to opt into these types of individual treatments. And so with that, I stand ready for questions.
Any questions of the sponsor? Seeing none, are we ready to vote? See no objection. Clerk, would you please open the vote? All those in favor of House Bill 192, vote yes. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? Clerk, would you please close and take the vote?
Mr. Chairman, 16 ayes, 0 noes.
Thank you. Bill passes, and we'll move on to calendar and rules.
All right. Thank you for everybody. That concludes, the last bill on our calendar has been rolled 1 week, so that concludes our business for the day. I appreciate the lively discussion and everybody's patience. And so without objection, we are adjourned.